1st, there's going to be some changes to the OASIS assessment. And these OASIS changes are going to be effective for any OASIS assessment that begins January 1 and after. If you do an OASIS assessment, on December 31st, you're going to do the old OASIS as you're doing now. But any OASIS form that you do January 1st and after will be with these new OASIS. The changes are not that many. There's a few significant changes that we're going to show you, and we're going to go over the screenshots in all scripts. Basically, there's going to be wording changes. These are really to better reflect the intent of the OASIS M item. Some items are omitted, some of them that we didn't need, that you're going to be happy with, that were really not necessary. There are some additions to the M items to get more specificity for the intent. Because as we all know, there are times when you look at these M items and you think, what on earth are they really trying to ask me? Because I can answer it 3 different ways. And then the last year, there'll be some M item changes to, again, better represent the intent of the OASIS item. So let's start out with the startup here. You know, they went from being in an oasis to a really dry desert, so they're hospitalized and they need some care now. Some of the little ones are in M150, which is your payer. There's going to be clarification of options 6 and 7, and those are the other government payers. And they're in there and they specify what they are. What we're going to make sure that you do is when you start using this, read each item. Their wording changes will clue you into what they want. M1012 has been omitted from all OASIS. You're no longer going to have to put in an inpatient surgical procedure. And 1032, risk for hospitalizations. They've added 3 more options, and I'm going to show you them in a few minutes. And they've clarified through the wording what these changes are and what they want. 1100, there is an addition, and I'm going to show you that as well, of residence care home as an example of assisted living facilities, congregate living facilities. And 1240, and you'll see this on anything that requires an assessment tool, it's going to add the word validated, because we're only going to be using validated assessment tools. So here's the 1033, the risk for hospitalization, and prior to this you only had 7 items. Even within this, there have been clarifications, so if I'm going to read them because there's quite a few changes. The first one is a history of falls, 2 or more falls, or any fall with an injury in the past 12 months. The second one is a change. They've added the word unintentional to the weight loss. So if somebody really intends on losing weight, and they lose weight, you won't have to check that anymore. It's only for the unintentional weight loss of 10 pounds or more. Multiple hospitalizations of 2 or more in the last 6 months. Multiple emergency department visits, 2 or more in the past 6 months. So it's specified to how many, because if it's just 1, decline in mental, emotional, or behavioral status in the past 3 months. That's a change in the wording of that. Reported or observed history of difficulty complying with any medication or medical instructions. For example, medication, diet, exercise. And this is over a 3-month period. Currently taking 5 or more medications. Currently reports exhaustion. I qualify for that. And here's an option to check other risks not identified or not listed. Or, as always, none of the above. And remember when I talked about 1100, it said that residential care home is listed in C. And C, under patient lives in a congregate situation. And they only used to list assisted living. Now they've also included residential care home, which includes your board and care facilities, so that it's more clear. Now we go to the 1300s, which are our wound care items. And the biggest, sorry about that. Again, in 1300, they've added the word validated for the assessment tool because we're only going to be using validated assessment tools. In 1306, they excluded stage 1 pressure ulcers and healed stage 2 pressure ulcers as an answer for that. 1307 omits the term non-epithelialized to be consistent with the WOCN guidelines, and they also added the wording excluding healed stage 2 pressure ulcers. And here's the biggest change in 1308. 1308 will no longer have 2 columns. They will only have the start of care column for you to fill out. When we go to discharge, we're going to be discussing the discharge. There's a new item in the discharge called M1309. 1320, they changed the wording to pressure ulcer that is observable and excludes pressure ulcer that cannot be staged due to a non-removable dressing. And they added the term device so that that would also be included. 1324, they changed wording to the NA response to distinguish between observable and stageable and removed the words observable and unhealed. So here we go, 1308. You see there's a column missing. Yay. You would still, by the way, complete this the way you always did at start of care. There's no change in the way you complete this at start of care. And in 1324, pressure ulcer that is stageable. So if you don't have a pressure ulcer that's stageable, you're not going to be, it's going to be NA. Patient has no pressure ulcer or no stageable pressure ulcer. Okay? In 1330, so we're moving on down, added the word device again when describing anything that was not observable due to a non-removable dressing or device. And in 1334, they removed response 0, newly epithelialized, because they don't have newly epithelialized, they're fully epithelialized or healed. 1340, they updated the skip directions. And just an FYI, we'll go into this, it's put it down into discharge as well. The 1350 is no longer going to be collected at follow-up or discharge, only at start of care and resumption of care. And that is the, the other wound that are being treated during this episode of care. So then we're going to skip down to the 1730, and again, they added the term validated along with the standardized assessment so that they know that we're using a validated assessment to assess the patient's depressive responses. They also moved the instructions to response 1 to the PHQ2 box. The instructions used to be on the side of the question, but they moved it down to the box so that it fits more where it's supposed to be. And they also added patient was screened to responses 2 and 3. The next group of changes, there's a few changes in the functional M items. In 1830, they deleted throughout the back from response 5 to include those who need the intermittent assistance throughout bathing. And this is because some people don't need it throughout the entire bath, but do need it at different points in the bath. 1860, again, wording changes, adding specifically. So in some of the examples, they've put specifically so that you know these are the specific to this item. And they've also added examples for the response 1 and 2. 1880 wording changes for clarity, again, adding the term specifically so that you understand. And again, in 1900, wording changes, 2 of them, adding specifically, but also referring to prior to the most recent illness in the terminology. So let's look at bathing, and you can see they took out in item 5 under bathing, unable to use the shower or tub, but able to participate in bathing self in bed, at the sink, or bedside chair or commode, with the assistance or supervision of another person. So they took out the throughout the bath, so that it can be for the intermittent pieces. Okay? (1860), I think there was 4 examples, and specifically, in 1860, you'll see under response 0, it's able to independently walk on even or uneven surfaces and negotiate stairs with or without railings. Specifically, this refers to needs no human assistance or assisted device. So they're telling you what this is telling you. So if a person needs anything, they're not going to be a 0. And in 1900, under self-care, and I know that's a little fuzzy, but it says specifically grooming, dressing, bathing, and toileting hygiene. So that there's no question about what you're looking at for self-care. And under household tasks, specifically looking at light meal preparation, laundry, shopping, and phone use. So those are the specific items they're looking for in household tasks. And in self-care, those are the specific items they're looking for in self-care. Okay, moving right along. In 1910, again, clarification to the standardized and validated assessment tool, removing the multi-factor falls risk assessment conducted, because they want us using the validated tools, and we're using the Missouri Alliance tool, which is a standardized and validated tool. In M2000, there were also wording changes. They added significant regarding the side effects. So when you're looking at side effects, significant side effects, and they added non-adherence to non-compliance to show that they include that as well. In 2004 and 2015, they added the timing so that at any time since the previous OASIS. So if the previous OASIS was a starter care, it's since that time. If the previous OASIS was a recert, it's from the time of the recert. If the previous OASIS was a resumption of care, it's since the last resumption of care. Okay? And 2040, clarification, again, to reflect time period to prior to his or her most recent illness. And also included at the time of or at any time since the previous OASIS assessment. $2100 has been changed, and it's now 2102. And they did clarification referring to caregivers as non-agency staff only, and it also explains specifically family members, paid caregivers that don't work for the agency, and they have that specifically stated there. The other thing in that is columns 4 and 5 are combined, and they're combined because they were kind of redundant. I think I have that on my next, there it is. Yeah. So it's now, number 4 says non-agency caregivers are not likely to provide assistance, or it is unclear if they will provide assistance. before each one of those was its separate column. They've combined that because it was kind of a redundancy in their mind. And you'll see at the top under 2102 where it says the willingness of non-agency caregivers such as family members, friends, or privately paid caregivers, so that it's clear now. And a lot of the changes they did in this OASIS C1 is really for clarity and also to eliminate some of the things that were redundant. Okay? In the Starter Care 2250, the NA responses have been revised, except A. And response D added specifically for depression, physician notification for positive depression screening. We all know that they don't have to have a diagnosis of depression, and they don't have to have medications. But if you identify through your screening that the patient is exhibiting signs and symptoms of depression, that will need notification to the physician. They also, and you'll see this in a second, they remove the line between the NA and the text boxes, and that actually makes it look better, as you can see here. So you see in the depression intervention, such as medication, referral for other treatment, or monitoring plan for current treatment, and or physician notified that patient screened positive for depression. And you see how nicer it looks instead of a line between NA and the not applicable items? You really know that NA refers to those not applicable items so that you can answer it more clearly. Okay, that's the research. Well, he's starting to climb the tree. He's out of the desert, and he's been able to walk a little bit more because he's had a wonderful physical therapy from St. Joseph's Home Healthcare. And his eyes are brighter, and he's looking better. But he's not quite ready for discharge, so we have to reinsert him.
I think he looks afraid.
And I don't know if he's afraid to be reinserted or if he's just afraid because somebody's taking his picture and he wants to be alone. Some of this is repetitive from the starter care because there are some items, but I wanted you to know that they're also in the follow-up research that they need to be addressed as well. So in the 1300s, 1324, did I miss any? No. 1324, again, changed the wording in the NA response to distinguish between observable and stageable. 1334, they removed the response 0 to newly epithelialized. 1340, again, the skip directions have been updated, and they've added the word device. And 1350 is no longer collected at follow-up. Woohoo! It's always nice when they eliminate something.
You guys rattle off these numbers, I have no idea. I have to see it. But I mean, I see it when you pull it up, yeah.
Well, it's not there. I think I'm hoping I put the 1350. Some of them I forgot to put in, and it's my fault. But there's the 1324. No, I didn't put it in. But those are all the wounds. He's had a complete change from being a koala bear to a penguin, able to withstand any kind of climate and run and romp and jump in the water. We did a good job, guys.
He's got a lot of friends, support system.
Yeah. So at discharge, you know, we have to collect additional information. And the first changes were in the 1041 and 1046, which is about the influenza vaccination.
Can I ask you a question about that? Why, when you go to discharge, when you go to that question, it doesn't show what you put on admission?
Yeah.
Why doesn't it show?
You have the ability, my understanding is you have the ability to look at what's put on the admission. Becky, can you answer
By
that?
going back?
And
But the
looking
reason
at the
why
whole
is it's
admission.
a different question. This is the discharge question. So you actually have to research it.
You have to go in, but you can pick up the assessment. You can,
Yeah,
you can
go
look
back,
at the
but then you
assessment.
have to open it all.
Yes, you do.
You can
So you
open up
find out
the
ahead
word.
of time and write it down.
Open
so
up
that you don't have
medications
to-
and look for fluverin.
Well, that's if we gave it.
That's if we gave it, but if they had it from another,
That's usually.
yeah. And I'm gonna tell you the changes specifically are that they put in the influenza vaccine reporting time period, which is October 1st through March 31st. And they'll say, has the patient had a influenza vaccine in the period of October 1st through March 31st. So they're not asking, we're not asking this question all year round. If it's not in the reporting area, you just skip it.
No, NA it.
Or
If it's-
NA it
yeah,
and skip.
If it's July.
Right, if you're asking, if you have a patient that's admitted in July,
Yeah.
you're gonna NA this and move on. Okay?
But half the year we have it.
Yes. And you'll have to look up the assessment, because it's a different M item than
We're
what's
just
that.
asking.
Sometimes I forget to ask them, though, that's the thing.
And 1046 was reworked to simplify the reasons the patient did not receive a vaccine. And it's, they took out from this episode of care so that it's clear that it's within a period of time. 1051 and 1056 involves the pneumococcal vaccine, and what they did is they took out the abbreviation of PPV and they put in the wording so that there was no confusion as to what they were referring to. And there they are. So if you look at 1041, you'll see what it says there. It says, this episode of care include any dates on or between October 1 and March 31st. You see? You see either say no or yes. And if it's no, you go right over to 1051. If it's yes, you have to answer 1045. Okay? And then 1051, the pneumococcal vaccine. It says, have they ever received the pneumococcal vaccination? For example, Pneumovax. And if not, then you just have to answer 1056. Okay, we're back to wounds. 1306 excludes stage 1 pressure ulcers and healed stage 2. That's not a change. 1307 omits the term non-epithelialized to be consistent. That's not different than what we talked about before. But M1309 is a change. This replaces column 2 that used to be in M1308 in OASIS C. And this is what it looks like. Now you have a handout that describes what you're going to be putting in there. And there's a decision matrix. So in 8C, they're looking for stage 2, 3, and 4 pressure ulcers. They want you to report the number that or are new or have increased in numerical stage since the most recent start of care rock. So here's your decision-making tree on the back. Well, it's hard to tell which is the back. The decision-making tree. What was the pressure ulcer at the most recent sock or rock? So the prior sock. On a stage 2. It was not present or a stage 1.
But would it be your sock or rock or research?
Correct.
Okay. Sock, rock.
No, actually, they're saying it's just soccer rock. They're not
No
referring
research.
to research.
Oh, okay.
So it's soccer rock.
Sock or rock.
No research.
They're looking for the outcome on this. What happened during their whole time?
What happened
that they
to
were
our
with us?
episodes of care?
So during this, if this patient was on for 4 years, they want to know, did they develop anything? Were we able to avoid it? Were we able to heal anything?
Or did they start with a stage 2 and it became a stage 3 or a stage 4 and then healed? So they're looking at the whole process.
Only the new ones, so.
Mhm.
Where do you enter 0?
There is a drop down. You see the drop down?
Yeah, you get in those little arrows.
If I go over there, you're not going to be able to see it.
Go ahead.
If you click on the box, you can hit 0, or you can scroll up and down.
That number thing, right here.
There's a drop down right here, Jim.
If you push the.
But that's for stage 2.
Right. So here's the stage 3
And 4.
and here's stage
Enter
4.
0. It says enter 0 if there are no stage 2, 3, or
Yeah,
Oh,
so
right.
it'd be
So you
0,
would add it
0,
in here.
0,
So just
0.
put
You,
0,
you
0,
have,
0.
you have to complete each one of these, either 0 or 1, or what? How many?
Yeah.
So if nothing, if they didn't have any new, or if they didn't have any that deteriorated, you're going to be putting 0,
0, 0, and all.
0, 0. Does that make sense?
Yeah.
Okay. So and that's for A to C. Now for D, these are for pressure ulcers that are unstageable due to slough or Eschar. Report the number that are new or were a stage 1 or 2 at the most recent start of care or resumption of care. Does that make any sense? Okay. So at discharge, we know that most of them are going to be healed. There are occasions when we do discharge patients without healed pressure ulcers because the family is taking over them. They're at a point where we don't need to go in, not even almost on a weekly basis. They're doing really well, and the patient is no longer homebound, and they're going to the wound care center, or for a number of other reasons that we do discharge patients that still have pressure ulcers. But this is looking at our outcomes. Okay. And there's really no difference in this wording than what we reviewed in start of care and the research already, that in 1320, we changed the wording to pressure ulcer that is observable. 1324, the NA response was changed to distinguish between observable and stageable. And 1340, the skip directions were updated and added the word device. And I did put them in there. 1340, as you can see where it says does the patient have a surgical wound? Observable, at least one observable. June 1350. And then we skip down to 1500 and 1510, and the wording here was revised again to catch the time period that was being reported, to include the time of the assessment at the time of or any time since the previous OASIS assessment. And again, as you're doing the discharge functional M items, we just want you to be sure that you're reading it so that you are getting the best response. I want to talk a little bit here about the start of care versus the discharge OASIS when we're looking at our functional M items, because we're really working toward having all of our teams on case management, which will help with this. But right now, we still have a lot of patients that are opened by one clinician and discharged by another clinician. And if we're not doing our assessment appropriately on admission, it's going to be skewing our outcomes. And our outcomes are really important for a number of reasons. Because if they aren't good, if you admit somebody who, for ambulation, you're saying they need no help, and at discharge you're saying they need no help, there's no change, and also there is question of homebound if it's a Medicare patient. If you say at discharge, the person that went out on starter care says they need some assistance with an assistive device, and the person that's discharging them says they are wheelchair bound, we have an outcome problem. So we're trying to really get everybody to understand the intent of these items and to standardize the way we look at them. On all of our OASIS items, we should really be looking at the bottom up. And I know that they go over this when they teach OASIS, but if they meet any of the lower responses, so if you go into a patient and you're assessing their bathing, and you say unable to participate effectively in bathing and is bathed totally by another person. Well, no. Unable to use the shower but able to participate in bed with assistance. Well, yeah. If they meet any of those, we have to stop there. And that is what you have at starter care. The problem with going from the top down is if you say able to bathe self and shower independently, well, no. With the use of the device, well, sometimes people stop right there and they don't consider the others and how much assistance these patients really need. So we really need to look at all of our OASIS items from the bottom up so that we're getting the appropriate answer, so that when it comes to discharge, we're getting credit for what we did, because we all do an awful lot of work in there for our patients. We do a hard job, and we just want to get credit for it. And this goes on, by the way, to Home Health Compare, and there are times when Home Health Compare is published in the newspaper. And if it's published in the newspaper, we're going to be compared to the other agencies in the area. We're going to be compared with the VNA, with North Star, with Seacrest, with everybody else around. And it's going to list us in our outcomes and them in their outcomes. And I think we should shine as much as we do when we're giving the care.
We used the example yesterday. When you go into the house at the start of care and your patient's in their pajamas, you ask them, where do you use the bathroom? They go, oh, down the hall. Can you get up? Not right now, I'm not feeling like it. If they can't get up, they probably can't do it because they're exhausted, they're tired, they just spent a week and a half or a couple months in a SNF. That means they're short of breath, they're exhausted, they're not doing well. When discharge rolls around, and they're fully dressed, and their hair is done, and their makeup's done, and they're looking like a whole new person, right now our outcomes are like this. Whereas it really should have been like this. You guys did all this hard work that we know that you do, because these people get off service with us, and they start down here and they end down here. You guys aren't taking credit for the work that you did. These questions are not intended to, well, of course they live alone and they don't have a walker. That's not the intent of the question. It's almost like waving the magic wand and going, if I can give this person someone to pull out those clothes, not bend over and tie their shoe, you know, do these things, put everything right here at the beginning. Doesn't mean it's not safe, but after being in a bed, when you're over a certain age, it takes a long time to get back to where you were, and they probably shouldn't be bending over. And like the one where it says use without an assisted device or going up and down stairs, I would answer having to use a handrail if I walk more than one flight of stairs. I guarantee it, because I will lose my stepping and I will fall. So most people are gonna be at that next level, even if it's your, person that's just running around looking just fine but only has IV meds. If they're over the age of 60, and I'm sorry, I'm only 41, but if they're over the age of 60, you're gonna go down to the next level, because they should. Imagine these people walking up and down stairs without a handrail. I mean, they all look like they can run circles around us, but going up and down stairs, you gotta really assume what's best for them and what's safest for them.
So it doesn't matter if they have a one-handed device or a two-handed device?
No, and it doesn't matter if they will never use it, even if you put it right in front of them. There's people that walk around with their walker and I'm going, oh my gosh, someone needs to follow behind them, because they're gonna fall.
Well, here's this number. The other thing is, you should be moving them at some point in your assessment.
Mm-hmm.
And if you have a patient that's like, I really, you know, I'm kind of feeling good. Okay, but I'd like you to come and show me your bathroom. Okay. This is not a person that's independent.
No, no.
Would you say, Stephen?
Repeat.
I mean, I remember struggling just because I would talk them into standing up. So I
You've
could
all
look
seen
at
that
their bum.
patient.
Yeah, I'm like, I have to clear your bottom. You don't know what's back there. We've been in the hospital bed. People get pressure sores all the time. I have to check. And I remember it would take me a good 10 minutes sitting there, getting their stuff, getting them all together, and then lifting them up, and then it's like, hurry! Their body starts to shake. I'm telling you, those people are all 3s and 4s.
Yes.
There is no way they're anything less. It's impossible. When I discharge them, are they less? Yeah. Yeah, now they're getting up, moving around. Maybe they're not 0s. Maybe they're a 1 or a 2. But I showed progress that this patient can now, from barely standing up, is able to go and follow up with their doctor.
So on bathing and toileting, when they're asking if they can do their own self-hygiene, it's not a matter of whether they can, it's a
Correct.
matter of whether they need help.
Right.
Correct.
I have a grandmother, I'll use her as an example. She's completely demented and is in a locked facility. She can get on and off that bathroom if you let her, but half the time she wets her clothes because she can't get her pants down as soon as she could. Does she let anybody help her? No. But she is definitely dependent in toileting, even though she gets herself to the bathroom. But the mistakes that she makes and the uncleanliness that is caused by it, she's really dependent in toileting because she does not do a good enough job.
And the key word there,
Safely.
safely.
Not what is she doing. If I
Just
answered
say
it,
with
what
the
is she doing,
ambulation.
I would
Yes,
put a
it's the same
0.
with all of them.
She walks
Most of your
without a
functional
walker.
moves have a safely.
Right.
It's there, and it's on the others as well.
If I would, what she's actually doing, she would be a 0. But what intended for that question is
Same.
she is dependent. She can't correctly clean herself to maintain and not get a UTI or not have breakdown, and she gets things on her clothing. So she is actually, yeah, she's actually a 4. But if I looked at what she was really doing, it would be a 0. Total difference there. And that one, walking on uneven surfaces. I mean, just imagine them going up and down stairs without using a railing.
Uneven, are you kidding me? If I go from my floor to my carpet, there are times, I'm not gonna say when, then I just go.
Right.
So just going from a plain hardwood floor to a high pile carpet is an even to uneven surface. And that could make a difference in a person's safety. Okay. Again, we talked about this in the other one at the time of or at any time since the previous OASIS.